I think most of the doctors are going through so many stress. So most of us, whether you, me, or whoever is, most of us are kind of used to 9 to 5 job. Behind the scene of whatever we are doing, we are not giving time to ourselves. I think that unhealthy lifestyle, because most of the causes of cancer, your diet is basically what you are. You are what you eat. The food is the fuel. Now, what kind of fuel you are giving the body to run? It depends on you. It will keep on running, but if you give a good fuel to the body, it will run in a better way.
Dr. Yesmin, welcome back. In the previous conversation, you spoke about what is cancer. You said that the normal balance of the body is kept when the new cells are generated and the old cells die, which is the process which happens every day. Now, the old cells not dying, is it a factor of lifestyle, poor eating habits, diet, or what causes that rebellion of cells that they refuse to die?
So what happens, most of the cells in the body are replicating except for few cells which are in the cycle we say resting phase, okay? That will be your brain or your heart. And there are some cells, once it goes injuries, then only they start replicating or undergoes the cycle. That is the liver, okay? Other than that, everything in the body will be, it will have its own cycle. The cell will keep on regenerating and dying off. So what happened, there is something called free radicals that happen in the body, okay? So now the free radicals could be due to any environmental factors which is affecting the body. Now this free radicals only goes and affect the cells and which can let it to some mutation in the DNA. Because for a cell to become immortal or give up the capacity to die or doesn't go apoptosis, in medical language cell death we say it's apoptosis. So if it doesn't undergo apoptosis, then it works in the DNA level. So that happens because of the free radicals in the body. In any body, there might be many free radicals. The capacity of the body, there are many genes, many cells in the body. In these free radicals, lead some disruption in the cells, which may undergo like cancerous change. Many genes are there which works on it and repairs. But unfortunately, if that repair doesn't happen, your cancer.
So, with respect to food, doctor, diet, how important is food in terms of preventing this production of immortal cells?
So, the thing is, there are many vitamins, minerals, which may help to increase your immune system, or it may help you to cleanse up the free radicals which are happening. One such thing will be your selenium. Selenium per se is found to be protective against cancer because it helps to kill the free radicals that is generated in the body. Second will be some vitamin like your vitamin D, vitamin E and all those, okay? But then the thing is, those things are preventive, and also there is a certain dose of it. You can't overuse it. I think 25, I'm not very sure of the range of it, but beyond that of selenium it also causes toxicity. So now the thing is, most of us, whether you, me, or whoever is here today and whoever will be watching this show, most of us are kind of used to 9 to 5 job. And I know people in medical field where I think most of the doctors are going through so many stress. And those who are working in corporate field, we know our life will be in from 9 to 5, and beyond that also the phone calls, works goes delayed. So behind the scene of whatever we are doing, most of us are not giving time to ourselves. I think that unhealthy lifestyle, because most of the causes of cancer are identified causes, okay? 50% of the causes are identified, out of which tobacco, as I mentioned earlier, also caused 20 to 30% of the cancer. Now the next common cause, identified cause nowadays, is your inactiveness, lack of physical activity.
Sedentary lifestyle.
Yes, with obesity.
Sedentary lifestyle is such a huge impact.
Yes, it does have. I would say sedentary lifestyle. Your chair, which you are sitting all the time, it is leading to some slow and silent pandemics. Behind the curtain, in the name of stress work, we are ignoring ourselves. What will happen, I'll tell you. In that 9 to 5 work schedule, most of us will have to report on time. We'll miss our breakfast, we'll miss a proper food, and by lunch we feel very hungry, and we're hungry when we're hungry, including myself. I don't know what to eat, so we want to eat a lot, and most of us in that time, in that hunger, we don't know what we are eating also.
So, in one of my previous conversations with another expert who had come in, I had mentioned that we all, as parents or as family members, we teach our children to eat 3 times a day. But all of us don't make it mandatory for our child to play for 2 hours a day. And especially as you grow up, I think if we impose that habit upon our child at an early age that you have to play throughout your life for 2 hours a day, do you think that kind of a mindset shift can really work against this explosion of cancer?
See, a healthy lifestyle is very much needed, I told, because it will boost your immunity. And if you are, your immune is well loaded only, it can fight against many things. Many things, like there are even some viruses which are associated with cancer. Okay, with a weak immunity, you are more prone to some viruses. Of course, there are some demographic changes also. Like some cancers are common in some part of India, some cancers are less. But mostly nowadays, some cancers, I would say, which we see, like your breast cancer, postmenopausal, endometrial cancers, few are associated with a very lack of physical activity and increase in obesity. And as you told, yes, it is true, nowadays we are being very inactive, because that 9 to 5 job, or our kids also has lost that trends of being active. If they have to run, they will just run in temple run, I think. So we should actually, discipline matters in anything.
And just 2 minutes back, you spoke about one of the key minerals example you gave of selenium. Now, selenium is also linked with thyroid gland health, right? I have hypothyroidism. So, does that mean that I'm deficient in selenium, and that could be something like that can be have an impact in 10 to 15 years in like how my body cell dies?
No, it's not like that. See, one another thing very common nowadays among females are PCOS. Yes, that is PCOS or PCOD, what you say. So those are things which are related to, the metabolism of the body. Many things that are interrelated with the metabolism of the body. But what I'm telling is, selenium per se is a mineral which, like many people here know about cancer, there are lots of misconception. Okay. When I'm talking about diet, diet per se is a preventive factor, or diet can work in two ways. Either diet can be preventive, or diet can be supportive during cancer treatment. This, whatever I'm telling, this won't lead like, selenium connected to thyroid and it lead to some cancer or something. But selenium will help you. If any free radicals happen in the body and you are having a selenium rich diet, it may help. But in a range, if you cross beyond that also, it will cause toxicity. So everything in the body, Rashmi, should be in a balance. Protein also, you need protein, right, during treatment. And therefore, to lead a very healthy lifestyle, you need a certain amount of protein. Let's say 0.75 mg you need of your body weight. So everything will help to keep your body healthy, so that it can fight any adversity if at all happens in the body.
So you're saying that the free radicals must be important.
Important Allah. Free radicals per se are those those are outcomes of some injuries that happen in the cells.
So what are the kind of foods that will keep your cells healthy and force your cells to function as they should, that is required for the good body health?
Every cell in the body will be in different phases of it. Your skin cells will be growing faster. Even your blood cells regenerate. So to recycle, it needs nutrition, right? And the nutrition comes from where? Whatever we eat. Your diet is basically what you are. You are what you eat. The food is the fuel. Now, what kind of fuel you are giving the body to run? That depends on you. It will keep on running. But if you give a good fuel to the body, it will run in a better way.
So are there specific categories of foods that are everybody should incorporate in their?
Yes, there are macronutrients, micronutrients that means you should have. Nowadays, see, the thing is, it's not like there is everything available now, but what I feel is people don't know what to eat, because in just a blink of eye you can order anything and eat any good, unhealthy. So you have more choices of unhealthy food around you. Only few people are being compliant to that healthy lifestyle. Now how many of us, we know almonds are very healthy, right? How many of us do wake up in the morning like old times, have one handful of almonds? Does anybody follow? Instead of what we are going nowadays more towards supplements and all, because we need the fastest instant. Today's lifestyle is more of towards.
But isn't that good? Like even if, see, okay, people are not able to eat almonds because of lifestyle like that, but is supplements counterproductive?
No, I'm not against any supplement. But one thing you have to understand, whatever your body derives from, your food, I would be more on that side, having a healthy food, healthy meal, and then, your body derives all the nutrition. Then having unhealthy foods and you are just adding nutrients on it. Because, we are living in a world, let's say, where we have educate sunshine, right? But nowadays so many people are vitamin D deficient despite of having sunshine. Now we are starting taking tablets of it. But nobody have time to go and expose them to the morning sun rays nowadays because of our lifestyle. And vitamin D itself is, it's an immunity booster. But who has time for that? We are mostly dependent on until we see our blood reports. Okay, so what happens, we take vitamin D only when it's needed. Like, okay, we started having body pain, then we see our vitamin doctors tell, okay, check your vitamin D, it's less, then only we'll go. But if at all we go for 10 minutes also in the sun in the morning hours, we may not need to go through all this, no?
Right. And doctor, like, how does physical activity in terms of, at a hormonal level, how does regular physical activity impact or can prevent cancer?
See, when you are more physically active, no, nothing is, again in the body also the same rule follows, you have to burn out what you are eating, right? Why you are eating, food is like, a support system to run the show or keep on running the whole day, right? But if we have a sedentary lifestyle, okay, and top of it we are eating, it will just add to the obesity level. No, obesity level, other than cancer also there are other factors. No, it will increase cholesterol in the body, it will increase so many cardiac issues will happen. And this PCOS and all whatever we are telling, no, it happens what, and if there is enough fat in the body also, your fat also get converted into hormone. What male hormone, female hormones are there, no, even the fat starts converting into those hormones, and those only unnecessary hormones lead to the changes in the body.
Okay. So, doctor, can you explain how exactly the body is being impacted by obesity, like the excess food which is getting stored in your body? What happens which can trigger cancer?
If you go and connect to obesity, again one thing I told you is the hormonal production. That will also cause, in the female body, you have a balance between estrogen and progesterone, okay? So one thing you have to understand, when either of that become over in the body, it crosses the balance, it goes signals to the brain, right? Then again from the brain some negative signaling will come for the body to stop, okay? But in such cases, what you are telling in obesity, let's say there is, because of fat, there are other extra production of estrogen in the body, okay, which is like in the another like third way production. What will happen, your estrogen will work in what, it will stimulate your uterus, no? So like that your uterus is overstimulated, there is a chance you might develop endometrial cancer in the future. Or that same estrogen can work in the breast, and how does it works, the estrogen help to the breast cells to replicate. So it overstimulated, there also the glands are overstimulated, the cancer might happen.
So basically you have to keep your hormones in balance. Does fasting help here? I see a lot of experts talking about fasting and autophagy, the concept of autophagy.
Two things I have to tell you, one thing. देखो, ऐसा नहीं होना चाहिए कि फास्टिंग के आर्ट पे आप बॉडी को एकदम you starve your body, which is also not acceptable. Now every this, I'm not a diet expert definitely, but all I want to say is you have to maintain a good
Eating window.
Yes, eating window. Now if you are someone obese, okay, even I myself, I may be fighting with my weight issues, okay. Now how I manage it, it may be I have to either increase my physical activity, and then eat a balanced meal, because everybody needs, every age criteria have their own set of calories, okay. For females it might be from around 2200 to 2400, for the males it might be little more, right? So but the thing is, that much is needed when I know to burn that much calories, okay. Now this fasting and all, whatever intermittent fastings and all, that may apply, okay, but with that you have to maintain whatever your body needs, okay. So just to burn those fats and all, I'm fasting, but I'm not giving enough nutrients what in the daily requirement it's needed for the body, both the micronutrients and the macronutrients, no, that will itself create disbalance, no.
Okay, so even if you are fasting or even if you're eating in a window, you have to make sure that how much ever you're eating, whether it's 2 meals, 3 meals, it has to be a balanced diet.
So you may stop eating to reduce the carb level in the body, but your body needs protein, macronutrients. You can't starve your body, Now there are See, again, I'm telling I'm not a diet expert, but what I'm saying is eat healthy, burn that out.
And like a person who's going through a treatment, what is a general guideline you give them with respect to diet?
Okay, one thing. Like when this something started, I told two things. Food per se is a preventive medicine and a supportive. So now what happens in cancer treatment? The backbone of the cancer treatment is a proper diet. Because first when we started this treatment, I told you cancer treatment is not something of 1 day or 2 day treatment. It may be few days, few weeks, few months, and some years also for some people. Okay. During that, now you have to understand one thing. Cancer treatment is a multimodality treatment, right? It may be surgery, it may be chemotherapy, or it may be radiotherapy. Okay. Now this per se, both three is not a very bed of roses kind of journey. Okay, it has lots up and down. So in the down phases, your good diet can help you to overcome side effects. And one thing you have to understand, chemotherapy per se, or radiotherapy per se, or let's say surgery, when you have done a surgery, now the surgeon has done the job, the surgery has been done. Okay, now what will be there after that? Healing. No, if the healing is delayed, what will happen? Now what helps in the healing? A good diet, right? Good wound care and good protein. Now if the patient is protein deficient, he is not eating well at all, then the healing it will not only affect the healing. What will happen? It may increase even the hospital stay of the patient. Second way, next come to chemotherapy, right? Now when coming to chemotherapy, see, chemotherapy, the basic, when I'm talking about the basic chemotherapy, now the target of chemotherapy is what? The dividing cells. Okay, there are some receptors it will affect. Now since the chemo is targeting the dividing cells, no? So what will happen? It will target some normal cells also, normal cell DNA also. So that is how you become very weak. Okay, your sometimes hemoglobin might go low, or your WBC may go low, and that is the reason your hair fall happens in few chemos. Now one thing, a myth in the society is, we think chemo it will cause hair fall for everybody.
Oh, it doesn't.
No, not all chemo causes hair fall. Okay, so there are some chemos which might help. Why your hair fall happens? Because it is working on the hair follicles also. Okay, that cells there, so that's why it happens. So to support that system, to support that treatment window, you give nutrients to your body with a good diet. Okay, yes, diet plays a very important role. Okay, but diet per se is a very very misunderstood thing in our whole our culture. Okay, because there are some people who thinks your diet can cure the cancer. Okay,
Oh yeah, there was this case about, I read about the one, I think a cricketer who said his wife beat cancer just through diet. Is that possible?
again, I'm not a diet expert. I'm just an oncologist. Diet per se, I told you, diet is the backbone of the while you are, it's a supportive system while you are going through the treatment. Okay, but telling someone that your diet can cure, I'm sorry, it is because, so cancer treatment can be initiated. One of the driving factor is your general condition, how you are. Now the first line, there is something called first line of treatment, second line of treatment, right? So it goes on. The first line of treatment, to accept the first line of the treatment, your body should be healthy, to have a curative intent of the treatment. That means I want to cure this disease. You should be healthy to take the treatment, right? Now if you are nutritionally deprived, your general condition is very poor, then the intent of the treatment changes from curative to palliative. Palliative means we just have to control the disease and give her symptomatic management to beat cancer. Okay, yes, but diet is an important part, because I have seen one thing and misleading is, before you ask, I'll tell this thing. There is one very common myth in our society telling, oh, cancer cells, no, you shouldn't give sugar.
I was just thinking about that.
So cancer cell, no, cancer cells sugar se बढ़ता है, when your body runs on sugar, your body, whatever you eat, no food, okay, there are so many cycles in the body. It converts to what is that fuel that body goes, your carbs and all get converted into energies in the body. And where does these energies come from? Even you eat protein also, no, whatever, there are cycles that convert into what is the currency for the body to run. It will get converted into sugar, then it will get converted into the energy. You have read in biology, that mitochondria, ATPs and all. So those are, some amount of carbs, some amount of sugars are interrelated, okay. But I have seen patients, my personal experience, okay. There are patients who have been told no sugar, whatever best protein diet you have to have, they will avoid. I don't know, they will go for some diets where they will just have, they don't eat this, don't eat that, and they will have muscle loss, something called as sarcopenia.
But in general, I heard that if you eat a food which is makes your body less acidic, that helps with cancer recovery. Is that true?
You are talking about the alkaline diet, detoxification. See, detoxification, that is something, but see, diet per se, no, once and again I'll tell, good diet is really important, no. But if you are, you have so many theories, people get confused. When you are telling this, that, just have whatever is necessary in your body to run the body. Okay, now you are depriving sugar, yes, overconsumption of sugar itself, other than cancer, you will get diabetes also. But there is a recommended dose also, no. Your sugar doesn't have to do anything, that it will increase your cancer level and all. But thing is, you shouldn't develop diabetes during the cancer treatment, which will be another comorbidity added. That is one. And another thing is, see, we are a population in India. We have the highest vegetarian population. Okay, now which we have to respect that. Okay, some people eat meat, some people don't eat meat. Now the protein, there are many ways to add proteins. No, now this thing which I have seen, there is a very close person I knew. Okay, who unfortunately is not around us. So young female who had a very rare uterine cancer. Okay. First treatment, she got recovered. Okay. Next, she had a recurrence. Now, in that recurrence phase, she was very much depressed. Why it came back? So, then someone gave her this idea. No, it's because you ate this, you ate that. But that recurrence rate per se of that cancer is very high. Okay, and she had, unfortunately. And in that phase, someone told you, I think your cancer treatment didn't work, whatever, so you should go for this diet, that diet. Again, she started with some diet. Someone told no oil, no meat, no sugar, nothing. So she was just living on this vegetables, pacha vegetables, or kacha vegetables or boiled vegetables, like that, and few things, but lots of restriction. Now what happened? She lost dramatically lots of weight. Okay, and after that, one morning she was reported to ER in her native somewhere, where she died because her sugar went to zero, nil sugar in the morning. Now that happens in our society. I have seen people. Now I'll tell you two scenarios how diet is important. Okay, so let's say there are two patients. Okay, one patient I know, very young. It's not a very early. It's not a very advanced stage of cancer. Okay, but again, the awareness is low, acceptance is low. She comes after 2-3 months. Okay, initially when I saw her reports and all, it was an advanced. It was not an advanced stage. It was in a very not a very early stage, but it around stage 1-2. So I told her, go to a, if you can come to Chennai or anywhere, go to a native something, go treatment. But someone at that time, because when you hear about the cancer word, you are so psychologically down, no. At that point, no, someone comes and tell you what you want to hear, no, you get very excited to accept that. So someone told that again, that I will tell you some upchars. I don't know what you tell,
Alternate medicine.
Yes, alternate medicine, you do this. Now what happened? She did. Now what happened? The cancer, within 2-3 months, the cancer have little bit, it has locally advanced, but it was not, it didn't spread anywhere. It is locally advanced. Okay. Now what happened? She is not in a state to treat because literally she is very weak now. Because she is having something which again that diet was a very strict diet where you don't eat this, don't eat that, but your doctor won't tell. When we are having the cancer treatment, when first we initiate the treatment, the first thing we write is drink lots of water, high fiber, then your high protein diet. That's how what happened. The patient comes. Now the thing is, challenge here was, it's not we can treat because she was not in a stage to treat. We can treat because her general condition was so poor.
That's very sad to hear. I mean, diet, imbalanced diet, or a uninformed consumption of food without understanding the implications of on the body can impact such a simple case of cure. It becomes just so.
Let me tell you one thing, okay? India is a country, we have facilities of cancer everywhere. Initially in Assam, where I come from, we didn't have much facilities. But nowadays, there also cancer centers have come up. A patient doesn't die of cancer because she didn't get the proper treatment sometimes, many a time. It's because they delayed it or they don't know where to go.
Lack of information is driving a failure in cancer treatment instead of the treatment itself. Doctor, I just want to understand, between men and women, who are more prone to getting cancer?
Okay, Rashmi, very interesting question. It depends on the organ, no? Let's say, okay, it's a joke indented question. Now the uterine cancer, cervix cancer, the females, we have uterine and cervix. Those cancer only happen to us, okay? Now the breast cancer, now I'll ask you one question. Do you think breast cancer is only among females?
Men also have breast issues.
Yes, breast cancer, but more prevalent among us, okay? But few cancer, it happens more in males, okay? Like oral cavity cancer, we see more in males. Esophageal cancer, we see in more in males, okay? Most of the cancer, other than what is gynecological related, the prevalence among men are little more. Okay. Also, it can be attributed because the population of men are more than females.
Or it can be attributed that women are more hesitant to share their problems.
That is true, Rashmi, because most of the breast cancer patients we meet, now the young population is the one who are like, okay, we heard about it, we should go. But the whole population, we have our mothers and all, they will be very hesitant to share those things.
Generally, women have the mindset where they feel that whatever happens, the finance of the family should be allocated to husband and welfare of children.
Females in our society, our mothers, our grandmothers, they had this, we come from a society, in our society is such like the mother nurtures it, okay, and she thinks like she have to nurture the the family, and the generation is dependent on her, so she kind of sacrifices. So her health, she thinks it's like a luxury for her. So why should I, if I talk about my health, it's like, they have to spend on it. So why to do that? So they think it's a part and process of the sacrifice they made. But now it's not like that. Most of us are independent. So if we are sick, if we don't feel good, we kind of can go on our own and do it, right? But that generation, they are dependent on someone, no? They have to ask someone to do.
Doctor, with respect to the younger generation today and, in correlation with lifestyle and diet, what is the one thing which you would really want a kind of a mindset shift in families which will help the future generations to not have such problems? Or, maybe over a period of time, at least the external impacts of cancer can be reduced due to lack of immunity. What would you suggest that families do for the younger generation? For, what should we teach our children?
See, Rashmi, this younger generation, they are already very sorted. I feel like, because I don't have much, connection with very young or something. But if you see, you or me, we both are mothers, right? The way we grew up and the way our kids are growing up, there's a huge difference. They are more knowledgeable than us. Because when we grew up, our form of knowledge and our source of knowledge was just confined to the books. Now it's not, right? Now they just can click anything and the mobile and everything can give information, okay? So these kids are always 10 step ahead of us. for us, we had to reach the 12th stage of like 10 or 12 to realize what we want to do in life. This generation, by the time they know to talk, I think they are quite sorted. Okay, they're so fast. Now that thing, it's up to us how we give it a shape. Okay, because of course they're smart, but then maturity has to come. Maturity will take some time. So it's up to us how we feed them the information, how they take it. And good thing is nowadays, man, trust me, there are kids I know who are talking about, they want to know about cancer. Some people, not everybody, randomly, you know, there are people who want to talk more than us. They will have more questions. Trust me.
I think that if schools incorporate healthy lifestyle discussions around food and sports more in school level, maybe as a community, as a society, we can become healthier. Maybe that's something we can do.
It is. That's what I told you. No, now we are living in a time where everything is available in this much. Okay. Now I'll tell you one thing. 30 years from now, leave 30, 10 years from, 15 years from now, okay, if you want to have a burger, was it available everywhere? No, right? It was like in just
A luxury to find
Yes.
a burger joint.
yes, nowadays it's just your phone. Yeah, and the burger joint is like 20 minutes away, right? So everything is available. It's up to us when to use it.
Okay, doctor. Thank you. It was such an amazing talk, doctor. I really loved this conversation. Thank you so much. I hope to see you soon.
Sure, Rashmi, it's my pleasure, and I'm very happy for this opportunity.